very unfortunate and a shame to this country and a disgrace to the administration, a disgrace to the name of George Bush, a disgrace to Congress that it is necessary for us to be here today. There have been two complete separate cover-ups on this whole issue. The first set of lies and cover-ups was when Christy Todd Whitman, the head of the EPA at that time, said that the air was safe to breathe. And knowing the contrary to be true, knowing that she was lying, she, echoed by the president and by Mayor Giuliani and by our governor at the time, all told people it is safe. They all lied, knowing that they were endangering the health of people by so lying. They said it was safe to go back. It is safe to work there. It is safe. Don't have to worry about what you're breathing. Secondly, they betrayed us again when they decided not to enforce the occupational safety and health laws. They made a very conscious decision. There was a memo written within a week and a half after in early October of 2001 within the city government saying we've got to enforce the OSHA laws to protect the workers. They decided not to. Down here at the Pentagon, they enforced the OSHA laws. There was pollution here at the Pentagon too, not as much as in New York, but there was pollution here. They enforced the OSHA laws. Nobody got sick. Thousands of people are sick because the administrator of EPA and the governor and the mayor and the president decided not to obey and enforce the law because it was more important to get Wall Street reopened a few days earlier than to risk the health of thousands of people. That was the first betrayal. The second betrayal was that they have never, to this day, properly inspected and cleaned the thousands of indoor apartments, workspaces in Manhattan, in Brooklyn, in Queens, in Jersey City, for all we know, that were contaminated. Nature cleans up the outdoor air. The rain washes the stuff away. The wind blows it away. It doesn't clean up the indoor air. There are probably today thousands, maybe tens of thousands of people living and working in still contaminated, not properly cleaned up apartments and workspaces being slowly poisoned. And we know something about the nature of this kind of contamination. It's cumulative. That means that if you waved the magic wand today and cleaned it all up, a certain number of people, we don't know who, we don't know how many, but because of the last 6 years of malfeasance, of their living and working in contaminated environments for the last 6 years, a certain number of people are doomed 10 years from now, 15 years from now, to come down with mesothelioma, lung cancer, asbestosis, you name it. But we also know that if we don't wave that magic wand and people keep doing this, there'll be a much larger number. So every day that we don't have a proper cleanup, proper inspection and cleanup program, such as recommended by my report in 2002, by the Inspector General in 2003, by Senator Clinton in 2004, by the Scientific Advisory Panel in 2005. Every day we don't do that, we're committing further murders. Further murders. The third betrayal, and the second cover-up, and I say the first cover-up is that we've never admitted that there's still apartments and workspaces that are contaminated to this day. It's never been properly cleaned. The second cover-up finally became unraveled only last year. And this is that thousands of people, first responders, mostly, but also residents, workers, school children, are sick because of their exposure to the toxic fumes after 9/11. For years, they denied it. You didn't see it in the newspapers. When we held press conferences on it, they were buried. Because of the excellent work of the Mount Sinai team and of the Daily News, this cover-up was finally unraveled last year. Now, except for the New York Post and a few others, nobody denies it. It's admitted. But what is done about it? So that was the second cover-up. It's uncovered now. But the third betrayal is, what have we done about it? Some of us in Congress, Carolyn, myself, a few others, have worked very hard to get funding, and we've succeeded somewhat. We finally got in this current budget, between the supplemental budget and the regular budget, about $160 million. We need about $250 million, but we got about $160 million. President recommended for next year $25 million. Of course not enough. It's not enough. Not enough. A deliberate further betrayal of the heroes of 9/11. When are we going to stop betraying those people who dropped what they were doing all over New York, indeed all over the country, and worked to help rescue people, to help save the situation? Abraham Lincoln, and I say this at every single rally I go to on this topic, Abraham Lincoln, in his second inaugural address at the end of the Civil War, said, "It is our duty to help him who shall have borne to care for him who shall have borne the battle, and for his widow and his orphan." That's why we set up the Veterans Administration, generally. We're not doing that. This country, shamefully, is not doing that. The Congress, when we tried to get Congress to hold hearings 4 years ago, we failed. Now, we've had hearings. My subcommittee I chaired had a hearing into why they lied. Other committees have had hearings into the current medical situation and the current need for funding and for setting up a program to set up centers of excellence and the corresponding centers all over the country so that people can be treated. We've had plenty of hearings, but not enough has been done, and the administration ignores it. And every time we think the administration is going to make some progress, they go backwards. They don't want to recognize the obligation we have to the heroes of 9/11. This is a betrayal. This is a disgrace. It's not worthy of this great nation. We ought to hang our heads in shame. And my hope is that in this Congress, now I assume you've heard that we have legislation pending, comprehensive legislation which we've introduced, which I hope we can pass this year, which will mandate a permanent funding structure and a permanent long-term healthcare situation for all the people who are affected by it. I hope we can pass it this year. If we can, we will finally have done our duty, assuming the president, of course, doesn't veto it. If we can't, we will have to get as much funding as we can, and after the American people exercise proper judgment in the next election, then we'll have a better situation, hopefully, and we'll be able to pass that legislation and begin to fulfill our obligations to the people who gave their all for us. Thank you very much.